Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for having me in this conference. It's my honor to be part of this prestigious place. And for our lecture for today, we will explaining, inshallah, about pain management in nursing and how the effect of pain management educational programs have on the competencies, especially in the critical care area nurses. We have here a systematic review we want to share with you. Okay, to start, let's introduce what is pain management, why pain management is very important. Okay, pain management is very important because in critical care setting, it is very significant aspect. Yes, and achieving quality patient care. Why it is very important? Because pain is something that the patient only can describe. We cannot assess it, even if with the tools that we have today, still we cannot assess correctly because it's subjective, not objective. That's why we have to make sure that our staff, especially in critical care areas, because the patient there is very vulnerable and sometimes they are unable to express their pain, especially when they are intubated on ventilator. That does not mean they don't have pain. They still have pain. So why we did this study? This study we did because we want to implement an educational program and make sure that this educational program will meet the need. Okay, for example, it will measure for us the effective means toward enhancing the competencies of nursing and pain management, and we will make sure to provide the best quality of care for our patient. Therefore, to start the first step, we needed to do a systematic review to understand the knowledge level in the research respective journals and to see what is the research level that we have regarding pain management, especially in the critical care area. So our aim was examining the effect of pain management educational program on the competency in the critical care areas. So moving on, let's start with the background. So when we did this systematic review, we made sure to check how the educational program have effect on the competencies in the critical care unit nurses. For example, the pain management, it's very vague subject. Pain is very vague subject. It is necessary to make sure we have the right tools to assess our patient pain. So with the existing results that we have from the systematic review here, we have a clear and comprehensive effect of the such programs, while we have studies that have examined also the pain management, especially in general nursing practice. However, fewer studies have focused on the context of the critical care. So sometimes we have challenges, especially with the nurses when they are resigning. So if the nurse resign after you train her, it's a big problem. It will make you also increase the costs because you have to train the new nurses. That's why we can see here the importance of reserving our nurses. It's our assets in the hospital. So after all this explanation, we understood that the role of the educational program is very essential and very important because we want to develop the best practices in critical care areas. So we must make ensure that the nurses are adequately prepared to the patient needs. That's why when we did this systematic review, we conducted our aim was to examine the effect of pain management program on the competency of the critical care nurses. That's why when we developed the educational model, we started to do trials and pilot tests to make sure and have validity and reliability of our tool before collecting and starting to do the educational program for the units. So what methodology I used for this systematic review? Systematic review, I used the PRISMA guideline. The search was done through PubMed, Sinhal, Embase, Coherence, and PsycInfo. The quality assessment was done using Joan Break Institute IBI checklist for the quasi-experimental studies because we are planning to do that studies through the quasi-experimental design. Moving on. So regarding this one, we had inclusion and exclusion criteria regarding the list that the nurses list that we want to acquire our study from, our sample exactly from. So we have the inclusion criteria design, no restriction. For the study design, all studies with empirical design were eligible for the inclusion in the systematic review. For the exclusion, we have editorial, opinion paper, and any other non-empirical publication were excluded from this review. So the language we use is the English language, and we exclude any other language of publication. For the population, we only specifically targeted the critical care area nurses, and we exclude all the other healthcare professionals, including physicians, pharmacists, etc. For the range of our study, we tried to make it as new as possible, and also to make sure that we get a wide range. We tried to start from 2017 up to 2024. We excluded any publication that happened before 2017. Moving on, what we found in our results. We found that 14 studies have met the inclusion criteria. We include in the review all the we include all the studies were quasi-experimental and achieved high-quality methodology rigor. These findings were synthesized into three major items. Okay, we started with the effect on knowledge and attitude. The other domain is effect of the nurse's skills of pain management. The third domain, effect on the clinical practice and the pain management. That's why it's important for the educational program to improve the nurses' competencies. That's the main goal, that we are trying to achieve a perfect educational program that have a positive impact on the skills of the nurses. However, we found out that the practice of pain management were not slightly improved through these designs that were published. That's why we concluded in this study that we need to have educational program that proved effectiveness. We have to build it to improve the knowledge, skills, and attitude. Also, that will result in the competencies among nurses in relation to the pain management in critical care settings. However, the integration of these competencies in real practice experienced some challenges. We have to address these challenges and make the necessary need to address the structural and systematic barriers that may affect the application of these competencies in clinical practice. That's all for today. Thank you so much for your listening. Hopefully we added knowledge to your knowledge, and we have you enjoyed the lecture. Thank you so much.